Let's talk about diminished ovarian reserve. What is low AMH and what should you know if you get a diagnosis of low AMH blood test? Hi friends, I'm Dr. Disha. I'm your gynecologist and natural fertility expert. I get asked questions about AMH all the time, and today I wanted to address this question. If you get a low AMH test, what does it mean? I don't know why, but post-COVID, I have seen an epidemic of low AMH in young women. Young women come to me in panic and they have their AMH memorized. They may not remember any other biomarker, they may not even know the root cause of the problem, but the AMH is on top of their list. They are really scared, they are really stressed out because of low AMH. Few weeks back, one 20 years old kid, yes, she is literally my daughter's age, 20 years old, she came to me with AMH less than 1 and she was told to freeze her eggs without looking at the root cause of the problem, which was autoimmunity in her case. This really breaks my heart. I want to motivate you to look beyond the AMH and look at the big picture, because AMH gets you feeling stuck, thinking that IVF or donor egg is your only option and you're running out of time and you need to freeze your eggs. And it is just not true. You're looking at the wrong biomarker and you're focusing on the wrong thing. It's not that AMH is not important, but it doesn't deserve as much focus as you're giving it. If you like learning about your body and understanding your fertility, please subscribe to this channel. This helps to spread our message to more people, and then more people can watch these videos. I absolutely love to break myths and empower women on their fertility journey. So what is AMH? AMH is a blood test and it stands for anti-Mullerian hormone. One advantage of AMH is it doesn't have to be checked on a certain day of your cycle, and that's one of the benefits. You can check it anytime, regardless of your periods. Now know that AMH also will fluctuate month to month, so it is very important to understand what it really means, especially due to the panic I have seen it stirs up in women all the time. Let's understand, what does AMH represent? Let me explain it this way. Imagine there's a treasure box inside your ovary and that is where all your eggs are stored. Now when you are born, your treasure box is full, and then throughout your life the eggs come out of this treasure box. Every month you have a group of eggs coming out of this treasure box, and from this group, one is selected to ovulate and the rest die. Now if you're on birth control pills or pregnant or you haven't hit puberty yet, all of these eggs are just dying and they are not ovulating, and the next month there's another group recruited out of the treasure box. Essentially, this process of egg loss is starting from when you are 20 weeks fetus inside your mother's womb. So before you're even born, you're losing eggs. Now understand that we don't have any test to actually see inside the treasure box and to know how many eggs you have or when you will hit menopause. We don't have any test for that. So the best we have is AMH and AFC, which is called antral follicular count. AFC is an ultrasound based determinant. These are the best we have. And these tests are based on the premise that we can check the eggs outside the treasure box. Remember, there is no test to check inside the treasure box, and use that test as an indirect marker for how many eggs are inside the treasure box. I hope it is making sense. And the logic we are using is, when the treasure box is more full, more eggs come out every month, and when the treasure box is less full, lesser eggs come out every month. So by checking the eggs on the outside of the box, we are getting an indirect idea of what is inside. Now the number of eggs recruited out of treasure box can fluctuate. So you will have a different number each month, and some studies have shown up to a variation of 30 in antral follicular count, and hence if I check your AMH every month, it's actually going to fluctuate as well. So I like to check AMH and AFC, both of them together, and AMH is going to fluctuate. That's why sometimes you can get an AMH and then you could check it and it could be higher after a couple of months. And it does not mean that you're growing more eggs. It's all a function of what is coming out of the treasure box. I see AMH improving in my practice significantly all the time, because sometimes it could be a short-term random suppression of the ovaries also. What I do not want you to do is to ever take two values of AMH and treat it like a linear process. And even an AMH of 0 does not mean no eggs. What is 0? 0 is less than 0.03. That is very low. Meaning I see people with low AMH, less than 1 all the time, and they are still able to conceive naturally when they work with me in my coaching programs to fix the root cause of the problem. Please also understand that low AMH does not impact your ability to get pregnant naturally, nor does it reflect the egg quality. So your body does not care whether you have 5 eggs or 20 eggs. Ultimately, you need only 1 egg to conceive, and hence working on your egg quality is much more important rather than getting stuck with your AMH score. Please also understand that AMH can be impacted by certain hormonal contraceptives. So if you're using hormone-based contraception, we can see a drop in AMH, and that is temporary. It depends on the type of contraception used. So progesterone IUDs have a smaller decrease. Progesterone-only pills have a bit more reduction in AMH, but things like the Implanon or birth control pills, they have a much more pronounced drop in your AMH, and it's not that you're having lesser number of eggs, it's really just suppression of the granulosa cells. And if you stop or remove that contraceptive and recheck your AMH in around 3 months, you may see an improvement. But sometimes the suppression is long-term, and you have to actively work on your endocrine system to bring back your fertility. This is called post-pill amenorrhea. Now, there are certain things that can permanently decrease your AMH, and some of them appear to be cigarette smoking, maybe some environmental exposures like radiation, chemotherapy, things like repeated ovarian surgery like the endometriosis surgery. These things can actually reduce the cyst from inside the treasure box. Another thing could be autoimmune disease. That is one of the top reasons why women may go into premature ovarian failure. So this is what happened to me in my mid-30s. I was diagnosed with Hashimoto thyroiditis, and I also had missing periods and low AMH. But when I healed my body with my protocols, my regular healthy cycle resumed, and I could even have a healthy pregnancy in my 40s. If you have a known autoimmune disease, or if it runs strongly in your family, I would recommend getting an AMH checked earlier rather than later. And also genetics, if your mom went into early menopause, or if your sister has low AMH or goes into early menopause, I highly recommend that you get it tested so you can take early action. You might be able to intervene at a younger age, either use science of epigenetics like my ovarian rejuvenation protocol to improve your AMH. Now, my work is not for everyone, it's only for action takers. And even if you don't want to do that, maybe you want to freeze your eggs or do something about it, whatever resonates with you. So if AMH does not impact your ability to get pregnant naturally, why are we even talking about it? AMH definitely impacts how many eggs we can get in an IVF or egg freezing cycle, and we can get only the eggs on the outside of the treasure box to grow. So if you have more eggs, we can get more eggs, and if you have fewer eggs, we can get lesser eggs. And that is going to change your overall IVF outcome. So that is why they are so obsessed with AMH when they are trying to do an IVF. And some of my tips to improve AMH naturally are to live a low inflammatory lifestyle, eat lots of fruits and vegetables, take antioxidants, take things like CoQ10, get a good night's sleep so that you can heal and repair, avoid toxins like cigarette, alcohol, stress, and optimize your vitamin D. If you need my help to look into the root cause of your low AMH, we can talk. I will drop the consultation link down below. Know that your AMH can improve, and that's what I see in my practice over and over again. I hope this video helps to remove some of the fear around AMH. It's not a death sentence, and you need to look at the complete picture.